So welcome everyone. My name is Nicole Holybar Walker. I am a director on our regional engagement team at the Emory Alumni Association. I have the pleasure of working with our Emory Alumni Environmental Network. So I'm excited today to welcome you all and give you the opportunity to hear from a fantastic alumna, Miranda Mitchell, as well as our co-chair of the Emory Alumni Environmental Network, May Bowen. But before I turn it over to May, I'm gonna share a couple of housekeeping for you all to just make sure that we have a smooth conversation today and make sure that you all feel comfortable. So I know we've all been on many Zoom calls at this point, but for the beginning, be sure to keep yourself muted. Towards the end of the conversation, we'll have time for questions with Miranda. So at that point, if you have a question, you're welcome to drop it in the chat or raise your hand if you would like to ask Miranda the question yourself and on camera. So Zoom has changed quite a bit from month to month, but now if you would like to raise your hand, you can do so by scrolling to the bottom of your Zoom screen, clicking reactions, and then raising your hand like that. But with that, I will go ahead and turn it over to May.
Hi, everyone. My name is May Bowen. I graduated from Emory in 2016 with a degree in environmental sciences, and I'm one of the co-chairs of our Emory Alumni Environmental Network. I'm really excited to be able to do this event today with Miranda and talk a lot about public health, which, as you all know, is a very hot topic these days, but it's also an issue area that's actually very intertwined with environmental science and environmental protection. So we're really excited to highlight that intersection for y'all. Before we go into the event itself, I just wanted to share for the alumni on the call in particular what EAEN is and how you can get involved. So we're an alumni interest group under the umbrella of the Emory Alumni Association, and we cater to anyone and everyone who's interested in environmental issues, works in green industry areas, and wants to learn more about these issues. We span everything from law, which is what I do, to public health, like Miranda, to folks who work in the energy sector and beyond. We have a couple of events coming up that I want to highlight, but if you're on this call now, you'll get an email from us at some point in the next few weeks talking about our upcoming events, so you don't have to worry about taking notes right now. But we're really excited about a couple of things coming up. First, we're taking Green Networking Night, which is an annual Emory event for students, virtual this year. It's a really exciting event, and for those of you who aren't local to the Atlanta area, you might not have been able to participate before, but it's a big networking event to allow students to talk to folks in green industry areas. So this year we'll be able to do that virtually, and we'll send you more information about that, but it's going to be toward the end of February and during the month of March. Next, on March 2nd, we're having an Emory Climate Talk, which is another wonderful sort of Emory webinar series that's been going on since the start of the pandemic. That's going to feature two alumni who work in sort of organizing their communities at both the local and the global level around issues related to climate change. So that's going to be on March 2nd in the evening, and you'll get more information about that as well. Then on March 25th in the evening, we're going to have a trivia night that's specific to nature questions, so birds and plants and trees, with one of our young alums who works for the Audubon Society. So that's going to be really fun. And then finally, later this spring in May, we're going to be talking to an alumna, Mandy Mahoney, who's running for local office in Atlanta and has a really wonderful background in environmental policy. So we're really excited to highlight her and her journey, hopefully to elected office. So with that, I will start by introducing Miranda. So Miranda Mitchell is an Oak Ridge Institute for Science and Education, or ORISE Fellow at the Agency for Toxic Substances and Disease Registry, which I will hopefully correctly refer to as ATSDR throughout the rest of this bio. And that's located in Chamblee, Georgia, and it's a sister agency to the CDC. And they work on protecting communities from harmful health effects related to exposure to natural and man-made hazardous substances. So they complete that mission by responding to environmental health emergencies, investigating emerging environmental health threats, conducting research on the health impacts of hazardous waste sites, and building capacities of and providing actionable guidance to health partners. So Miranda works closely with the EPA and other federal, tribal, state and local officials to do that work and do particularly in-depth health assessments for Superfund sites, as well as petitioning sites to be brought to the attention to the ATSDR. So her primary task as a health assessor ORISE fellow is to evaluate community exposures and provide results and recommendations as they relate to human health effects resulting from evaluated exposures. So she's a graduate of Emory University's Rollins School of Public Health, where she got her master's degree in public health with a concentration in environmental health, and she'll tell us more what that means. Now, so first I wanted to ask Miranda how you became interested in public health in general.
Yeah, absolutely. So thank you so much, May, for having me. So I first became interested in public health when I started at Oxford College of Emory University. And I see that there's some Oxford alumni on the line, so happy to see you guys here. I started working at a rural public health department, the Newton County Public Health Department, which is the public health department for Oxford, Georgia. And at that time, I was working on a research project investigating food deserts and the incidence of food deserts in the southeastern United States. And by food desert, I mean an area where there's limited access to fresh and nutritional food and produce. So at that time, I was collaborating, it was a collaboration between Emory and the Newton County Department of Public Health to compile a literature review on food deserts in Georgia and to identify realtors, shops, places that take food stamps within Covington, and to get that information out to members of the community. So after that experience, that was my first experience in public health. I had always studied environmental science, very similar to most people on the call today. But I began to see the intersection between the environment and our health through that research. And because of that, I decided to apply to the 4+1 program at Emory University, which is the Bachelor of Science in Environmental Science and a master's degree in public health with environmental health. When I started that program, I decided that I wanted to get some technical skills and decided to join a lab at Emory University. And I approached the lab's principal investigator, Dr. Thomas Gillespie, and joined his lab. So his lab was focused on, or is focused on disease ecology and the study of emerging infectious diseases in wildlife populations and in humans. So when I started working in Tom's lab, I was working on a project studying zoonotic infectious diseases in cattle and in primate populations and in humans in Madagascar. And at that time, I was learning a diagnostic test that we all know very well now, PCR. And so learning how to screen for pathogens. And I absolutely fell in love with the work. I found a real passion for studying emerging infectious diseases and decided to continue on in his lab doing my master's thesis with him.
So following up on your thesis work in particular, which, as you just explained, integrated environmental science and public health in understanding these sort of infectious diseases that come from wildlife. Can you tell us a bit more about COVID-19 and its status as one of those diseases?
Absolutely. So we are aware that COVID-19 is a disease of zoonotic origin. And that's important. That's important for us to know because it's important for us to be able to track the zoonotic origin of diseases to assess spillover risk, which is something that presumably happened with the emergence of SARS-CoV-2 in human populations. So from what we know in the literature and what I'm aware of in the realm of CDC is that we're aware that there is a transmission dynamic where SARS-CoV-2 may have originated in bats, in bat populations, and may have spilt over to a intermediate reservoir, being a mammal, a ferret, a mink has been implicated, a civet has been implicated as well, and then spill over into humans. Something that my lab, Dr. Thomas Gillespie's lab, really looks at is why are there more increasing emerging infectious diseases in the world? Why are we seeing more infectious diseases spill over from wildlife populations into human populations? And the reigning theory of his work and my work and a couple of other folks in the field of infectious disease epidemiology is that human changes to landscape, anthropogenic changes to landscape, could be increasing interaction between human and wildlife populations, which allows for a window for increased transmission between wildlife and human populations, which is known as a spillover event of a pathogen to humans. So that's something that I studied in my master's thesis when I was studying a bacterial pathogen in bat populations and its transmission dynamics between the bat, domestic animals, and humans. But it is a very important and emerging issue in the wake of COVID-19 and something that we need to continue to focus on the environmental determinants of emerging infectious diseases.
Thanks for that explanation. So next I want to pivot a little bit to talking about your career, sort of where you are on your path to working in public health. So if you want to tell us a little bit about some of the other internships you did while you were still a student, what the ORISE Fellowship is, and sort of where you are on that path.
Yeah, so the ORISE Fellowship, is a Oak Ridge Institute for Science and Education Fellowship. So it's a national fellowship associated with Oak Ridge Laboratory in Tennessee. And what the program does is it places individuals in different government agencies or different appointments. And my appointment was at ATSDR, which is the Agency for Toxic Substances and Disease Registry, which May, as you said, is a sister agency of CDC here in Atlanta at Chamblee campus. In terms of my career, I am in my second year of that ORISE Fellowship, and I've really very much so enjoyed it and hope to join CDC or ATSDR as a full-time employee focused on either infectious diseases or risk assessment. And ORISE is a really, really great program for graduates to be able to do that work. In terms of my internships during school, I did do an internship as well with the US Environmental Protection Agency, with the EPA, which had always been a dream of mine. And I was able to work with the Office of Children's Health Protection at that time, focused on reducing lead exposures to children, which is something that the federal government at that time in 2017, 2018, and really wanted to focus on as a federal lead strategy. So at that time, I worked at the Office of Children's Health Protection, and I was able to cut my teeth in the world of toxic substances and their exposures to humans and the health effects resulting from that.
Awesome. Can you tell us a little bit more about what your day-to-day involves in your current role at ATSDR?
Yeah, absolutely. So our day-to-day at ATSDR is very different. It looks very different these days than it previously did. We have many folks, pretty much everyone under Health and Human Services in ATSDR and in CDC are all hands on deck for COVID-19. So many of us have been doing deployments, meaning we've left our tour of duty to assist with COVID activities, whether that be surveillance, contact tracing, working with hospital data. My first COVID deployment was actually in April and March, in which I was answering the public's questions through a helpline called CDC Info. And it was very, very tough. It was a very tough time because, you know, SARS-CoV-2 is a novel virus and we didn't have a lot of answers at that time. So our day-to-day has changed a lot in this past year. But generally my day-to-day is I work on doing health assessments for Superfund sites. So Superfund sites are sites that are toxic waste sites that are provided with money, a trust fund from Congress that was created after the Love Canal disaster in New York, in Niagara Falls, New York. And the Superfund site program is an EPA program in which EPA assesses the environmental contamination at a site. And then ATSDR on our end and the CDC side, we assess the health impacts. So our assessment is not as focused on the environmental aspects, but more so on, you know, how does the Superfund site affect community members? So my day-to-day is a lot of risk assessment, a lot of calculations, a lot of, you know, calling and working with community members. And in normal times, we would go into the community and, you know, seek out community concerns and get information from community members. But these days, you know, it's mostly FaceTimes and just sort of trying to figure out what individuals are concerned about when they live around a Superfund site.
And so my last question for you before we open it up to everyone else to ask questions is, obviously you've been focused on a couple of Superfund sites and you've done some COVID work, but I'm sure there are tons of other interesting issues that ATSDR and the CDC are thinking about these days in terms of environmental health. So are there any hot topics that you think the community in this call would like to hear about?
Yeah, absolutely. So there are a couple of hot topics in environmental public health right now. Obviously, one of which is COVID-19, and there are so many facets to COVID-19 that we need, you know, bright minds and experts to approach. There are other emerging issues right before the COVID pandemic. Something that my agency was looking at, ATSDR, was the vaping epidemic in the United States, in which we did a study of vape pens and found that the chemical that was associated with higher hospitalization rates was a chemical called vitamin E acetate in vaping pens. And because of that, there was a whole recall of vitamin E acetate and a specific health advisory about vaping. So that is an emerging issue that we have not dropped. We're still aware of it. Another hot topic right now is we have been keeping our eyes on a set of chemicals called PFAS, which are per and polyfluorinated alkyl substances, which are ubiquitous in the environment. So they are in food packaging, they are sometimes in, you know, a result of water contamination from Air Force bases, using firefighting foam. And pretty much everyone in the United States has had exposure to these chemicals. So we're keeping an eye on them and their interaction with human health, particularly immunological effects and cancer, thyroid effects. And we are also doing a study on the interaction of those chemicals with COVID-19. So there's a lot that we're still, you know, manning the ship despite the pandemic. But there are so many issues right now that really highlight the need to understand both environmental science and public health when we're working in public health.
Awesome. Well, I would like to open it up to questions from our audience now. And as we said at the start, you can raise your hand and I should be able to see that in our participant little thing to the side, and I'll be able to call on you. Or if you'd like to just type it in the chat box, then I can ask the question for you as well. So looks like we have a question from Mr. Hussain. So you can go ahead and ask that.
All right. Thank you so much. Thank you so much. And Miranda Mitchell, thank you so much for meeting you today. I'm Dr. Aurangzeb. I'm from Bangladesh and I work for the similar pollution. And we always look for the reference value given by or set by ATSDR in my previous research. So I'm surprised today I could meet someone who worked for the ATSDR. And so really interesting. I have a PhD in environmental health and from Nagoya University, Japan, and my research is really focusing into the arsenic pollution, chromium pollution, and recently I'm planning to develop some project related with the PFAS you just mentioned before something, because recent days we found a severe pollution with organic pollutants like PFAS in our supplied water in the capital city of our country. And we know that the PFAS and the similar organic pollutant is really cancerous, and we really like to assess it more rationally, since the people are drinking the water, so there might be some biochemical change taking place inside. So I wish to talk more about it. I would love if you could share your email so that we can communicate later. But I know it's quite partial. So I'm so sorry to all the folks that I'm quite focusing to my country, but I think similar pollution is present basically, and is caused by the industry. So such kind of heavy metal is really causing some global concern, though we ignore it most times. But I'd love more about it. I'd love to hear more about it in future. So if you don't mind, if you can share your email address so that I can communicate.
Yeah, I would be happy to share my email and of course talk more about PFAS. You know, with our mandate with ATSDR, my main focus is national Superfund sites, but you are absolutely correct that PFAS is an emerging concern throughout the world, as well as heavy metals. So that's a great point, and I'm happy to share my email.
Thank you so much. That's all from my side.
And so the next hand we've got is from AJ.
I think that's me. Sorry, those are my initials. I was wondering what % of your work
Sounds like we might have, I think she's muted.
AJ, I think you might have muted yourself.
Yep, there we go.
Oops, sorry. I was wondering what % of your work is reactionary and what is kind of proactive, where you're able to suss out the effects of something before they kind of happen, if that makes sense.
Yeah, that's an excellent question. So I don't know how I would quantify it in terms of percentages, but that is a really good question because, you know, with our Superfund sites, most of it is reactionary. So a Superfund site is put on, sometimes is put on the national priority list. And as a result, we are mandated by the Superfund law and by Congress to respond to that and write a health assessment. So the Superfund work is primarily reactive. However, our research on PFAS and other emerging chemicals, as well as responding to the vaping epidemic, is partially reactive, but also preemptive as well, trying to stay ahead of the curve and aware of emerging concerns. So that's a great question. I don't know how I would quantify it. I think that these days it's far more preemptive than reactive, actually, which is not usually how we function. But with everything with COVID-19, we try to stay on top of emerging issues.
Thank you.
Next question from Amy.
Hi, Miranda.
Hi, Amy.
I wanted to know if you had heard anything about the high levels of toxic metals that have been found in baby food brands. It's been getting a lot of national attention recently.
Yes, so that is something that we're aware of as well. And we know that children are also disproportionately vulnerable to heavy metals and toxic substances more generally because of their low body weight. And because they're developing as well. So that is something that we are aware of, something that we have been looking at for baby food and heavy metals. We've also been looking at PFAS in common home items, including things that children might be exposed to. So that is definitely something that we like to focus on, that we are working on. I'm not sure what the response with that is, but it's definitely interesting and it's important as well.
So we also got a couple of questions in the chat that I'll read out. So first,
Okay.
we have a question about how difficult was it to get an internship at the EPA?
Yeah, so it was difficult. I did apply to the EPA, I think twice before I got my internship. But if you find a program that you're really interested in, if you show that you want to learn and that you're willing to help, it's very likely that you will get hired. It really depends on the program. The office I was in, the Office of Children's Health Protection, is a very small office. And as we were just saying with Amy's comment about children and infants, with the Trump administration's focus on the federal lead strategy, there was really a need for people to work on studying lead exposures to children. And so because of that, I was able to get my internship and join at that time. So it is difficult, but Rollins and Emory have so many resources. I was able to find out about the opportunity because Ariadne, our advisor for environmental health, had sent out the opportunity to us all. So really, Rollins and Emory has so many resources for you to be able to get those jobs.
And for the students on the call, the Green Networking Night event that I mentioned earlier is a good opportunity to seek out and try to make some connections with perhaps Emory alumni that we might have right now who are working at EPA or at similar agencies that you could talk to about opportunities. So definitely look out for that. The next question in the chat that we had was, could you tell us a bit more about what went into the field research component of your thesis?
Yeah, that's a great question. So I didn't really expand on my thesis so much because I know we have so much to cover. There's so many hot topics. But my master's thesis was very unique. When I was studying a pathogen called Bartonella, and that pathogen causes cat scratch fever or trench fever, which are both neglected tropical diseases in humans. And we wanted to study the prevalence of those pathogens in bats and in their parasites across the country of Costa Rica. So we went to about Costa Rica. I got to be Indiana Jones basically for a month. And we surveyed dozens of bats in each cave. The caves also, interestingly, were from different land use type categories. So some were in agricultural pastures, others were deep in the rainforest. And so we traveled across the country, sampled different bat species, a dozen bat species in caves throughout Costa Rica, and we screened for this bacterial pathogen. What we found that bats and their parasites were sharing this pathogen, were sharing specific strains of the pathogen. And we also found one of the most notable findings from my thesis is that we found new genotypes of that bacteria that had not been documented before. They were not documented in GenBank or NCBI. So that suggested to us that not only was the bacterial pathogen diverse, but new genotypes were emerging as well. So it was really interesting research.
Looks like our next question is from Elena.
Hi, Miranda. Thank you so much for talking. You're just so inspiring every time I hear you speak. I wanted to know, as an early career professional, I know it's definitely a transition navigating the non-academia world. So what are one or two pieces of advice you'd like to give to your younger student self about your career?
Yeah, that's a great suggestion. You know, the federal government, getting positions in the federal government can be a little bit of a black box to some folks. I would recommend great opportunities and programs like ORISE, like the Oak Ridge Fellowship and other similar fellowships. I think that the Professional Public Health Association has some fellowships, and really those are great opportunities for emerging professionals to get their foot in the door in the federal government. I would also recommend right now looking into usajobs.gov, go to that website and take a look at the opportunities that are available right now, because we absolutely need people to work on these emerging issues, not just COVID-19, but there are all kinds of opportunities popping up right now.
Do we have more questions for Miranda?
I have a question. So I know you work around a lot of hot topics, obviously, but what piece of data has you most concerned for future, and what has you most hopeful?
That is a very good, very challenging question. So I really do consider myself a jack of all trades in terms of public health. You all have heard all of these different opportunities. I think that something that is most concerning and something that should be on our radar, you know, there's so many, but one of which is really the impending climate crisis is something that we need to keep an eye on and be aware of, and how that will affect vulnerable communities and how that will affect health, you know, not just from heat illness, but also the possibility that climate change might increase the prevalence of emerging infectious diseases by allowing pathogens to have a larger range or area in which they can emerge. So the tropics moving upwards or the climate getting hotter, resulting in increased infectious diseases. So I think that the climate component is something that is really important and that I think we should focus on. That is of concern. I think what is so inspiring and something that keeps me going every single day from, you know, watching everything happen with this pandemic is that I am just so absolutely inspired by the public health community and their resilience and their dedication to, you know, more than just themselves, to, you know, going on the frontline workers, you know, dealing with pandemic fatigue and continuing to fight for the health of our world, really. So I would say that that is something that inspires me, and I'm really excited to see so many people interested in public health now, and so many people interested in medicine, and so many people interested in studying the interaction between the environment and infectious diseases. And to to me, that's very inspiring.
Great, I agree. Well,
That's
thank
a
you
great
for
question.
everything you're doing. Yeah.
We got one more in the chat box. What was the hardest thing you had to overcome in your master's program?
Probably forcing myself to stay at the lab for hours on end. No, I think that a challenge was, so part of my master's thesis, the analysis that I used is something called phylogenetic analysis, which is something that is a tool that's often used to look at the zoonotic origin of infectious diseases, because it determines the relationships between strains of pathogens and how closely related they are. So working on that phylogenetic analysis, I think that was definitely one of the hardest things I had to do, because it required a lot of research. It required a lot of time in the lab, and it was very challenging. But I absolutely enjoyed it, and was able to contribute to my field. And I think that challenging yourself and trying to learn new tools like that is the best thing that you can do for yourself in school. I had no idea how to do phylogenetic analysis. I had no idea how to do Bayesian analysis, but I just threw myself in there. So I think that's the hardest thing, but the most rewarding as well.
We got another question in the chat. It says, can you comment on the intersection of social and environmental exposure? And to what extent do you think either or both are modifiable in our public health response? How can we be better about being proactive rather than reactive?
Yeah, that's a great question as well. So something that at Rollins that we are very aware of are the social determinants of health. So what social characteristics or impacts are determine health outcomes. And we try to focus on those and be aware of them so that we can be more preventative and proactive, as you said, rather than reactionary. I think that that is where the public health field should continue to go. I think that, in the past, a lot of the focus was reactionary, but I think that preventative medicine is going to be so important. And I think that, really, I guess the answer to that is putting policies in place and just really better education about health and our social determinants of health, so people are aware of that interdynamic.
All right, we still got a good few minutes left if anyone else wants to raise their hand or submit a question to the chat box. Give it another few minutes. Don't be shy.
I'll ask another question. As someone who is on the outside, does not work in the public health or environmental arena, I hope this doesn't come off as silly, but what is it about the bat community that has the focus so much on learning about the spread of diseases through bats?
Yeah, no, that's not a silly question at all. That's a great question. And don't worry, I've heard all the silly, like I said, I was answering COVID questions back in April. So I heard all the silly questions. Bats are really interesting and a really important reservoir for emerging infectious diseases. Not only COVID-19, but Ebola virus, SARS, the original SARS, they are perfect reservoirs for disease, meaning that they can carry disease and pass it on to a host for a number of reasons. Firstly, they live very long. They live very long lives. So they are able to accumulate quite a few pathogens. Secondly, their body temperature runs normally just high. So the pathogens within their body do not affect them. So they really act as a reservoir rather than a host for the pathogens. Another thing is that they have very expansive migratory pattern and are able to cross large amounts of land. And so because of that, they're able to bring pathogens from one area to another. They also have a lot of species diversity. There's quite a few variables that make bats really an interesting group to study for emerging infectious diseases.
Thank you. I appreciate it.
So we've got another chat box question. So would you say that Rollins prepares global environmental health students in not just the science aspect, but also the policy aspect as well? For example, what goes into creating policies that benefit global environmental health? Or would you say it focuses solely on research, risk assessment, et cetera?
Yeah, so I would say that Rollins definitely is very holistic and all-inclusive in terms of finding the link between science and policy. So as I was saying with my lab, working with Dr. Thomas Gillespie, who is jointly appointed in the environmental science department in Emory and also in Rollins School of Public Health, he works with the United Nations. He works on a One Health committee focused on putting environmental policies in place that protect wildlife from human destruction of habitats, and therefore also decreasing the chance of spillover effects of pathogens. So I would say that Rollins is very good at making the connection between science and policy. In every disease that we study, in every class that I have taken, we talk about the social determinants of health. We talk about the policies around a specific disease, or we talk about the environmental causes, or we talk about the social causes. So I think that it's very integrative, and you're definitely able to get both. You're able to get the policy understanding, and you are also able to get the technical abilities, which I was able to do, such as, doing PCRs and doing risk assessments and all that kind of stuff.
So I'll ask a question too. I was curious what was your favorite class that you took at Emory, either as in your undergraduate or in your +1 year at Rollins?
Yeah, so actually, I want to say a Rollins class, but my favorite class actually was a class that I took in political science called Policing, Imprisonment, and Politics. And it was about policing in the United States and the history of the police. And I found that class gave me such an amazing, helpful perspective on imprisonment and policing in the United States, and the racial bias that goes into that, all of the variables that go into it. And that class really just sits with me, especially this past summer, with everything that was going on with Black Lives Matter. I just really think that class impacted me in a way that I cannot describe, and it really just opened my eyes to the reality of policing and imprisonment, the carceral state in the United States. I did also make a connection there with environmental science, and I was, for that class, I was looking at the placement, where prisons are sited, which is very similar to where Superfund sites are sited, which are in rural communities, vulnerable communities, often communities of color. So I think that class, I would recommend it to anyone. Dr. Michael Owens, if you can find a way, if you're at Rollins and you can find a way to take his course, I would recommend it.
Awesome. We've got another question in the chat. When you joined your lab, did you have previous lab or research experience, or was everything new to you?
Yeah, so it was all new to me. I had to cut my teeth on the Madagascar site that we were looking at pathogens in cattle and primates and humans. So I was able to learn through working on that project. And then as a result, I was able to get my own project. So it was my first lab experience.
And remind us when you took that step to join that lab. What year were you in your studies?
Yeah, so the 4+1 program, so I was a junior when I started. So I worked in that lab for 3 years.
Any other questions? Probably have time for a couple more. If not, we can go ahead. Do you have any parting thoughts, Miranda?
I don't think so. I'm just really appreciative of all the great questions, and I'm happy to answer any other questions. I can maybe provide my email with you, and if anybody wants to reach out after.
Yeah, we can. We'll do a follow-up email on this event that hopefully we'll talk about some of the events I shared earlier as well, and we can include that there. And so before we log off, I'll run through those again just so everyone is aware, but we've got really great events coming up. The Green Networking Night is a really awesome opportunity for any of you on the call who are students at Emory right now, whether you're in the college at Oxford or at Rollins, you can participate. And for alumni on the call, it's a really awesome opportunity to give back and help out current students who are thinking about joining careers like yours. The March 2nd Emory Climate Talk is also going to be really great. We have 2 young alumni who are speaking there, Camilla Schrammick and Angela Jang. Angela works for the Sierra Club in Georgia, and so she's had a really exciting year sort of working at the intersection of environmental policy and politics, and she can talk a lot about local organizing. And Camilla works in Copenhagen at a European sort of NGO that is focused on transitioning to renewable energy. And so she can talk more about sort of that global perspective on working on the climate crisis. So we're really excited about that event with Emory Climate Talks, and generally recommend looking at the Emory Climate Talks website for information on future webinars. They feature alumni occasionally, but they also feature, big name speakers from the field of environment and climate. So with that, thanks everybody for coming. We appreciate it, and we'll follow up with an email with some more information about EAN and Miranda's contact. Thanks everyone.
Thank you.
Thank you.